$10 billion. That's how much money Congress set aside for a program created last year to help veterans get faster access to health care. But some veterans say the new choice cards failed them. I-Team reporter Jackie Calloway shows you what went wrong and what the VA is now doing about it.
Congress created the new Choice Card program last November to reduce patient wait times to get medical attention.
I would not be able to get an appointment for anywhere from 60 to 90 days.
The card gives veterans like Terry Heinisch, who've been waiting more than 30 days for appointments, or who live more than 40 miles from a VA facility, the chance to see a private doctor. But this retired Navy senior chief petty officer says the Choice Card program gave her the runaround for weeks.
I finally, about 40 days into this, got an appointment.
Terry lost faith in the card after she says the VA's third-party administrator sent her to the wrong doctor.
And the receptionist said, I have no idea why Veterans Choice sent you here. We do not do cataract surgery.
What was your reaction?
It's infuriating.
Several thousand veteran patients out of the 108,000 treated at Bay Pines qualified for the Choice Card program since last November. But the VA tells us they only recently began tracking complaints. The VA says Bay Pines receives about 7 calls per day about the program.
They should get the care that they deserve, okay, on a timely basis. And that's the goal.
Congressman Gus Bilirakis co-chairs the Veterans Affairs Committee.
I questioned the VA secretary a couple months ago on this particular issue. I said, you're making it too difficult for the veteran.
The VA admits there's issues and told me they've made several recent changes to streamline the process. In an email, the VA explained, we are doing this by partnering with the program's third-party administrator, HealthNet, to streamline administrative processes. Through these efforts, we aim to improve customer service and also reduce the time it takes for veterans to obtain community health care provider appointments for routine care.
The timeline for the appointments is crazy.
Donnie West, who spent 7 years in the Marines, says he's still waiting to see the improvements.
How long did it take you to get in to see your doctor after you were put into the Choice program?
About 8.5 weeks, I finally did.
The VA handles authorizations and approvals while HealthNet, a third-party administrator, sets the appointments. But the veterans that we spoke with say they've experienced problems on both sides.
It took me for a while, Jackie, to even get them to determine the difference between a dermatologist and a rheumatologist.
Congressman Bilirakis says if the VA doesn't fix the flaws with the Choice Card program, he'll introduce legislation that will.
If it works, and I believe it will work, then we'll make it a permanent program.
Jackie Calloway, taking action for you.
Well, we reached out to HealthNet, the program's third-party administrator, but have not yet heard back.